We're tracking the rise of COVID-19 cases here in Indiana. 3,800 new cases reported today and nearly 120 deaths dating back to the past 2 weeks.
Right now, the state is averaging about 4,300 new cases a day. The state's positivity rate falling to 13.4%. Just over 3,000 Hoosiers are in the hospital right now with COVID-19. About 15% of the state's ICU beds are available. President Joe Biden today announcing 3 new initiatives to counter the spread of the Omicron variant.
It is our top story here first at 4. Now, that new plan includes deploying 1,000 military members with medical training to help hospitals that are overwhelmed. Also, the administration is expanding access to testing, setting up a website where Americans can have tests delivered right to their homes and for free. Finally, the president is ordering FEMA to open pop-up vaccination clinics. This will help get more doses to those who need them.
We should all be concerned about Omicron, but not panicked. If you're fully vaccinated, and especially if you got your booster shot, you are highly protected. And if you're unvaccinated, you're at a higher risk of getting severely ill from COVID-19, getting hospitalized, and even dying. So the best thing to do is get fully vaccinated and get your booster shot.
The push for increased testing and vaccinations comes as the Omicron variant spreads rapidly through the U.S. The CDC reporting Monday Omicron is the dominant variant, representing 73% of all new cases. Across the country, hospitals experiencing a surge of new cases will soon get some much needed support. The Biden administration planning to deploy at least 1,000 military personnel to help.
Today, we also learned a 20-person team from the U.S. Navy is headed to IU Health Methodist Hospital to offer assistance over the next month. Fox 59's Kristen Eskow joins us live in the newsroom with more on what this means for Hoosier hospitals. Kristen.
Well, Daniel, the Indiana Hospital Association tells me additional hospitals around the state, particularly in northern Indiana, are requesting this kind of assistance. Now, this comes as many Indiana hospitals are treating more patients than ever before.
With the Omicron variant that is looming, it just feels like there's no end in sight.
Brian Tabor with the Indiana Hospital Association says there's no part of the Hoosier state that's immune from this latest COVID surge. He says Indiana hospitals are treating a record-breaking total of 12,000 patients per day, and the Omicron variant has just arrived.
I don't know really that the system can take a big surge from Omicron or where we would be if we had an incident like occurred down in Kentucky with tornadoes.
The federal government is now joining Indiana's COVID-19 response. IU Health Methodist Hospital will receive 20 doctors, nurses, and respiratory professionals from the U.S. Navy. IU Health wouldn't talk to us Tuesday, but sent us a statement saying it's grateful for the help. Other hospitals are requesting similar assistance or support. Eskenazi Health is seeking help from the National Guard.
We need all hands on deck. And so this should be a very objective sign to Hoosiers everywhere that, hey, we're in dire straits here.
With more and more patients and staffing shortages, Indiana hospitals say they're doing what they can to accommodate the need.
We are boarding patients in our ER, which means they sleep overnight in the ER because there are no staffed beds available up on the floors. And so we're over 100% capacity on a regular basis.
Now, hospital officials continue to point out the vast majority of COVID patients in the hospital have not been vaccinated. Now, there's no word yet on whether additional Indiana hospitals could receive this kind of federal assistance. We did reach out to the Indiana Department of Health to speak with them about the federal help that's coming to our state, and officials denied our request for an interview and referred us to the Department of Defense. Live in the newsroom, Kristen Eskow, Fox 59 News.
Kristen, thank you.